COVID-19 has ripped through India, leaving horror and heartbreak in its wake. Officially, the virus has killed 400,000 Indians, but the real death toll is thought to be much higher. The race is on to vaccinate the country, though not everyone is convinced.
The government needs to tell us why we should get it. What are the benefits? They are failing to give us information.
It's especially a problem in rural areas, where 2/3 of Indians live. Vaccine hesitancy is a major threat to India's race to beat the pandemic. India's devastating second wave of coronavirus infections appears to be ebbing away. The focus now is on vaccinating as many people as possible to prevent a third one. However, in a country as diverse as India, there remains a diversity of opinion towards vaccinations. Namisha Jaiswal reports from the north of the country.
It's their turn to get vaccinated. And these young residents of Rohtak in the North Indian state of Haryana have been eagerly waiting for it. After a month of low vaccine availability, supply is finally catching up with the demand here. Officials say online slots in the small city are booked quickly, and allowing offline registrations in June has improved access to the jab even further. Doctors believe India's massive second wave could have erased vaccine hesitancy.
After the second wave, people are scrambling to get vaccinated. They say, please vaccinate us. We definitely want protection from this virus. I believe vaccine hesitancy is negligible now.
In a village 20 kilometers from the hospital, these men paint a very different picture. Only 2 of them have been vaccinated because they volunteered in the vaccine trials. And even they don't feel confident about the benefits of the vaccine. In the last 2 months, more than 50 people have died in this village. These men say it wasn't the coronavirus that killed them, but fear.
Even doctors have died after vaccinations. There was a vaccine they recalled, I think. Now they are saying plasma therapy isn't useful. They just keep changing their stand.
In the village, people aren't afraid. The air is clean here. The problem is in the cities because of the air. They're felling trees. It's a city problem. It is in the villages.
The village's local health center wears a deserted look. All year, only 600 people have been vaccinated. Supplies are limited. And there isn't a rush anyway. And it's all the more reason that the few who do show up stand out. Sunil Bhardwaj travelled here from a nearby village to get his father the second dose.
Many people worry about fevers after the vaccine. My father had one too, but I got it as well and I had no side effects at all. The vaccine is very important. Everyone must get it.
Bhardwaj may be a lone voice here right now, but he's emphatic. He tells everyone around him that the vaccine can save lives. India is slowly solving its supply crisis. But it may face an uphill battle against skepticism to prevent a crisis of demand as well.
Well, let's speak to Anwisha Dutta, who is a senior researcher at the Christian Michelsen Institute. Thanks for joining us on the COVID-19 special. Can you just explain to us how governments in India are trying to tackle the challenge of vaccine hesitancy?
Thanks, Rob, for that question, and thank you for having me on the show. But as we know, vaccine hesitancy in itself is a very complex phenomenon, and we even see the whole anti-vaxxer movement in the global north, where people are much more educated. So clearly, education is not a reason that makes people take vaccination or not. Now, coming to India, we see more hesitancy in rural areas as opposed to urban areas, and there are several causes for that, and very briefly, let me touch upon those. So first, being in rural areas, historically, there has been an aversion towards Western allopathic medication, and as opposed to urban areas where people have had more access to healthcare to begin with, and that's allopathic healthcare. Now, add to this mix other factors like religion, caste, gender. So, for example, there's been a lot of hesitation amongst the Muslim community because they feel that there is pig fat in the vaccination, or the Jain community in India who think that the vaccination is not vegetarian, or the Hindu community who might think there is cow serum in the vaccination. We also see that the vaccination rates are higher amongst men and then women, given that it's a patriarchal society as well. And finally, added to that are various other factors like mistrust in the state itself. And also, if we see India has been very successful in its polio vaccination program, but those are catered to children and not necessarily adults. So all of this, I think, makes vaccine hesitancy a very complex problem. And how is the Indian state dealing with it? So of late, they have brought together a lot of religious leaders, and they are making these religious leaders appeal to their own communities and talk to them and to persuade them. There have been celebrities going on TV or local politician, because there is also this neighborhood effect. So if someone in your locality gets the vaccine, you are more likely to take it. So those are some of the
I mean, the big issue is diversity, right? I mean, India is an enormous country with an enormous amount of diversity. You've talked about the different things there, you know, in terms of, you know, city and rural, but also religious groups. How do you go about tackling a pandemic in a coordinated way when there's so much difference within the different areas?
I think it has been a major challenge, and we can see the state kind of failed, especially to contain the second wave of the pandemic. And a part of that also rests in not being prepared for what was coming. Now, how do you tackle it? Something that really worked in India in some states as opposed to other. So let's take Kerala, for example, a state that managed to curb this or contain or manage or govern the pandemic very well, as opposed to one of the most populated states in the world, Uttar Pradesh. And what explains this are historical investments into decentralizing local governments, into building healthcare and other infrastructures, which necessarily did not happen in case of Uttar Pradesh due to, say, corruption, due to other political factors that have been at play. And therefore,
so is this about really having tailored approaches to different areas? Is that what you mean by the decentralization?
Yeah, so decentralization means where you decentralize power up to the local level, and you give, say, in Indian case, the panchayat, the local governing bodies, amount of powers and resources to govern, because they are the last leg of delivery of services to the people in the most remote rural areas. And therefore, the management should have been kind of bottom up, rather than, you know, complete top down. And so we see a diversity of responses. And of course, within that, we have to feature for other social, political stratifiers, as I mentioned before.
And Anwisha, is there anything that we've seen during the second wave in India that leaves you thinking that a third wave can be prevented?
So yeah, a couple of things. Firstly, I think we have learned that we should not already accept victory over a virus which is still ongoing. We need to be more prepared and not dismantle healthcare infrastructure and other infrastructure facilities. And particularly, we need to take into account, for example, the migrant crisis that affected the first wave, so that it could not have happened much in the second wave. So taking into consideration the most vulnerable groups, and so that in a third wave, these communities can be protected and there can be more preparedness.
Anwisha Dutta from the Christian Mickelson Institute, thanks for joining us on the COVID-19 special.
Thank you so much.
And now it's the part of the programme where we put one of your questions to our science correspondent, Derek Williams.
I had my second dose of Sinovac a week ago, but I also want to get a vaccine certified by the WHO and EU. How long should I wait?
Since this question came in, the vaccine made by Sinovac, which is called the Verocell vaccine, it's received an emergency use listing from the WHO, though it's still under review at the European Medicines Agency. But I still want to look at this topic because I receive questions like this one all the time. That's down to the fact that in trials, inactivated virus vaccines made by Chinese manufacturers had lower efficacy numbers than, for example, approved messenger RNA vaccines. And there are also now some doubts about how well they work against the Delta variant of SARS-CoV-2. So let's look at what the experts are saying so far about getting booster shots with the second type of vaccine after being vaccinated at least once with another. Mixing and matching is already going on with different vaccine platforms. Big clinical studies looking at a range of combinations of different vaccines are progressing pretty quickly, and there don't seem to be any big red flags so far when it comes to safety. Many experts believe that mixing and matching, even within the two-dose regime that most vaccines require, that might actually turn out to be more effective at preventing COVID-19 than 2 doses of the same vaccine. So I don't think anyone is expecting that a third booster shot with a different vaccine would cause major problems. In a couple of Persian Gulf nations, for example, they've already begun giving a third Pfizer-BioNTech booster to some high-risk people who were fully vaccinated with a Sinopharm vaccine more than 6 months ago. The WHO, however, still hasn't made any concrete recommendations.